Welcome back to the Bryan Devore Connection. I'm your host, Bryan Devore. San Diego State University, one of the great universities in San Diego, has a wonderful program focusing on aging. It's called the CEAL program, CEAL. I'm going to let the person to my right tell you what that's all about. The man to my right is Steve Hornberger. Steve, how are you doing today?
I'm doing well, thank you. And CEAL is the Center for Excellence in Aging and Longevity. It was created in 2022 after a year-long process of having over 25 stakeholders in San Diego and the region meeting to meet the challenge of how could we create healthy aging across the lifespan. We met for a year, monthly meetings, and you can imagine what those were like.
Yeah.
We had academics, researchers, public officials, community members, older adults, stakeholders, advocates, and CBOs and industry, all meeting to say, how could we meet this challenge? Because we're clearly, the population is aging. Out of that year-long process, we had two big goals. One was that SDSU would become an age-friendly university, and two, that we would create the Center for Excellence in Aging and Longevity. Proud to say, as soon as we made the proposal to President de la Torres, she reviewed it for a day, said yes, go forward, and we proceeded the process. And in 2022, we became, I think, the 77th university in America to be an designated age-friendly university. And basically, it's how is the university, the entire ecosystem, faculty, students, staff, alumni, be committed to lifelong aging. And the center took a little longer because we needed to do certain things, but it got started, and we have 5 big areas. We have longevity, age-friendly universities, and I'll get more into that, policy, workforce, and research. I always forget one, so I'm getting better.
Good.
And so that's how we got started.
Got it. And tell me real quickly, age-friendly, what does that mean?
It's a program that AARP drives across the country. It's basically saying, how can we get a community to become age-friendly? There are different things that need to be done in age-friendly communities. It focuses on built 8 domains, and they just added a 9th one for disaster prep, in terms of social inclusion, medical care, built environment, employment, etc. So right. Communication. And I'm proud to say that we've done 9 of them already.
That's great.
And what's exciting about it is we have a series of listenings. We start with a survey where we put it out to the community, and we usually get a couple of thousand responses, basically saying, we like this, we need more of this is really good. And out of that, we then meet with, have listening sessions where we meet with community members. In San Diego, for instance, we had 12 of them. We just finished Oceanside. I think we've had 5. We're getting started in 2 weeks in Encinitas, where we open it, people come and say, we tell them this is what we've heard. Do you agree? Because we want to get both quantitative as well as qualitative information. And usually people are tweaking it, and they say, no, we don't need all of that. We need a little of this, more of this. This is really good. And out of that, we then we meet with municipal staff to say, this is what we're hearing from your constituents. What do you hear? And I got to admit, immediately, municipal staff we're overwhelmed. And that's true. They certainly are overwhelmed. But when we point out that this is going to be a 2 to 3 year plan, and a 5-year plan, and a 6 to 10 year plan.
Not tomorrow.
Not tomorrow, and you can relax. They jump on board because they too see the changing aging demographics. And my experience, public servants are always wanting to do better by the community.
Yeah. What I like about CEAL, and you mentioned that you have public policy, and you have private industry, you have all the different sort of stakeholders, because let's face it, aging affects everybody in all those areas. And if you only silo 1 or 2 of those things, you don't have a comprehensive plan.
You're singing my song. Yes, because historically, I think because of how our society was just rolling out, you needed to have a lot of legislation and rights and responsibilities and advocacy around making changes that would benefit older adults. But I think now, with the demographics as they are, By 2030, California is going to have 1 in 4 Californians going to be over 65. By 2035, this is a powerful statistic. Worldwide, there will be more people over 65 than under 18.
Wow.
That's the first time in human history that we're that much older. And part of it is because we've certainly solved overwhelmingly infant mortality and accidents and early death in terms of medicine. So we're learning how to live longer.
Yeah.
I think our challenge now is how do we want to live longer?
Right. Not just to do it, but how to do it.
Right. What you're hearing in the literature is it's no longer about life expectancy, because that's just a number.
Yeah.
It's really health span. How do you want to live those extra lives? The mantra is if you make it to 65, but for an accident, you're almost guaranteed to make it to 75. And if you make it to 75, but for an accident, you're almost guaranteed to make it to 85, because we learned how to manage the chronic complex medical conditions that historically would help us die.
Yeah.
And so now the challenge is, well, if we got these extra 20 or 30 years of life, what do we want to do with it?
Right, exactly. Talk about some of the programs that they have at
Sure.
SEAL.
Well, I think I want to highlight a couple.
Yeah.
So I mentioned, and all of these are on our websites, and I know you're going to highlight that later.
Yep.
And please come join and look and get involved.
Yeah.
The two that I think I want to talk about is the research area. It's called. I'm smiling because the people in that year-long process made it deliberately so I can't pronounce it correctly. They had fun with me.
Yeah.
So it's RARN, Regional Aging Research Network.
Okay.
And they created this whole criteria and values and principles, and I think it demonstrates in action, because we said, yes, it's going to be academic and research. So yes, we want a faculty member from SDSU and a faculty member from UCSD, because they've been partners with us throughout this, to be co-chairs. But rather than just keeping it as an academic process, we also said a third co-chair would be a CEO from a large CBO in the city in San Diego. It was actually Meals on Wheels.
Okay.
Because we wanted to have it so that it would always be centered on and focused on what's happening in the community, what's happening to older people. Because sometimes research and academic circles gets much more focused on what's available or what's a particular person is interested in. I mean, one of the first tasks that Bryan had to do is almost compile an inventory about what's happening in aging research, because people work in little silos and little areas. And so this gives us an opportunity to have a broader and more collaborative and I think community-wide approach. And last year, we just finished, we had 5 research projects. The one that my staff did, Michelle Matters, who's just fantastic. Well, all my staff is fantastic, truly. You should get to know each and every one of them.
Yeah.
Michelle Matter, Fernando Reyes, Jocelyn Protopappas. She did a national review of shared housing, because there's an emphasis now or a push to have intergenerational housing between older adults and grad students. And so that's on our website, and it's helping to inform some efforts to create more shared housing in San Diego.
Good.
Yeah.
And I know that's a big focus, I know, for a lot of people. And I'm looking at that as well for my clients or for others, because we're running out of housing. We don't have enough housing. The biggest number of, the rising number of people who are becoming homeless are seniors. The majority are seniors.
50% of all homeless people are over 55, and the number one reason is they're on fixed incomes. And as owners and prices rise, even if it's 2%, on fixed income, they can't manage it.
No, they can't. What's on the horizon for SEAL?
Well, let's see. In terms of workforce, so let me give you that. We trained over 7,200 caregivers in 19 months.
Wow.
We actually trained 8% of the whole state's training in that with those 2 grants. We learned how to use it virtually, and we had 80 hours of training in 6 tracks of 15 hours. And 15 hours was important because If you have 15 hours of training, you're then eligible to be certified to be a home caregiver for IHSS, in-home services and supports. Um, Out of that, what we developed was a process called peer support, whereby, because the programs were available for both paid caregivers so they could learn more skills and get a financial incentive, but also family and friends who were unpaid caregivers, and that's the majority who
Right.
provides care, could take the classes. And the concern was, well, most people learn how to do caregiving by what you saw in your household when growing up or what your culture tells you. And so we wanted to create a place where people could dialogue about all the classes they're taking and see how that made sense and how it can inform what they're doing. It wasn't like just take the class and keep doing what you're doing.
Yeah.
And so we started with peer support, and it was slow to begin with, but Fernando just did a great job of engaging community, reaching out to people, helping people to realize, if you take your mother to the hospital, to the doctor's visits, that's caregiving.
Yeah.
If you help with meals, if you help with the daily living.
You are giving care.
Right, and because they just thought of, well, I'm just being her son,
Yeah.
or I'm taking care of my aunt or my grandma, because most families, that's what you think about.
Right.
You don't think about it as I'm doing a task.
Mm-hmm.
So we wanted to give them an opportunity to be able to talk with one another. And so we created these peer support groups. And I'm proud to say, as we speak, there's 14 to 18 virtual peer support groups every month.
That's amazing.
Because people, once you give them that opportunity, they see the value, they appreciate it, they get to realize, oh, I didn't realize Bryan does it that way. Oh, that makes good sense. Or, Bryan, I just want to get to know you because we're in the same circumstance. And so
Right.
this sense of community, belonging, appreciating one another is really powerful to help not reframe, but maybe expand the idea of caregiving.
Yeah. Well, and like you said, so many people are giving care for their loved ones and they feel alone, like they're the only ones doing it out
Well
there.
said.
So to have that connection with others is super powerful.
Right. And so we feel like we've done a really good job of helping to understand the front end of helping older adults. So in January, we're going to be launching an aging leadership certificate program because we want executives to understand the new dynamics and what's happening because the system is just exploding.
Yeah.
The number one occupation for the next 10 years is direct care staff. They expect they're going to need an additional million, and they have to replace 9 million. So it's
big numbers.
Those are big numbers because we're just getting older.
Right. Yeah, and if we don't have enough of the younger generation who is available and wants to go into the industry, that's going to be a real problem. So we got to focus on the whole system.
Yeah, and I'm excited about it. We got the AARP for volunteer for California. Joe Garbanzo is going to teach one. A VP in serving seniors, Jennifer Sinat, is going to teach one. The CEO of Glenner Center for Families is going to teach one, Scott Tardy, and then Michelle and I will teach the 4th class. And so be on the lookout. They're going to start to open registration. This is in September, early October.
That's some great people right there that you just mentioned.
Well, because we really want to help inform and prepare people to be the leaders of the coming decade.
Yeah.
I know we're living through lots of chaos in terms of funding and whatnot, but when all is said and done, we're still going to have growing numbers of older adults. In San Diego, for instance, between 2020 and 2030, the older adults will be 30% more diverse in terms of race, ethnicity, language spoken, sexual orientation, and 30% more poorer. And so these are complex issues, and these are our community members. And so we need to learn how to better prepare and to innovate, because if we be honest with ourselves, what we do for the people that we serve, really good work generally.
Yeah.
Though there's always a scandal, like there was one this morning in the San Diego UT about a provider that is being charged with elder abuse. So we need to be able to get rid of the bad apples, but really help everybody else appreciate the opportunity and the responsibility to take care of our older adults.
Right, for sure. There's a lot more that SEAL does, and their information's on their website, which you can see right now on screen. If you're listening to this as a podcast, it's going to be in the caption, but Steve, who runs the show there, does a great job, and everyone does a great job. Steve, thank you so much for coming and sharing about SEAL. Fantastic work you're doing.
Thank you. I appreciate you getting the message out.
Absolutely.
Bye now.